everyone. I'm Dr. Tan Ping, consultant obstetrician and gynecologist. So this month, as I mentioned last week, it is Caesarean Awareness Month. So that is why I decided to do all my weekly videos this week, this month related to birth. Because this is a Caesarean Awareness Month, so it's all about birth, so we'll talk about birth. Last week, I have already had one video on this series of videos. So my first video started last week on natural birth and Caesarean, whereby I actually described the differences between natural birth and Caesarean, the pros and cons, all the advantages and disadvantages, and the things that women need to face and women need to know when they decided to choose for a natural birth or Caesarean. So if you have missed last week's video, you can go and scroll up my Facebook, or you can go to my YouTube channel, Dr. Tan City Clinic, and look for the video, okay? Alright, so today we will continue with some of the questions that were posted up earlier. So once again, if you have any questions about birth, please post it up in the comment section, yeah? So normally I will go through whatever you ask and I'll try and answer all your questions, okay? So today I'm going to address a very interesting question that I often get, especially private PM. People like to PM me and ask me this question. This is from Eileen Kong. Eileen Kong. Eileen Kong asks, is it possible to have a vaginal birth after 2 previous Caesarean? This is a very common question that I get, and it is also a difficult question to answer. But I will tell you my experience when it comes to VBAC after 2 Caesar. Okay, what is vaginal birth after Caesarean? A lot of people have 1 Caesar and they want to try again. I mean, when you have 1 Caesar and you decided to try natural birth again, you will realize that the bulk majority of doctors will still allow you to try, but there will still be a small minority of doctors who will say, no, you had a previous Caesar, you must Caesar again. That is a small minority, but the majority of doctors will still say, yes, you can try. But when you have 2 Caesarean, then it's the other opposite already. When you have 2 Caesarean, it's the opposite situation altogether. You will find that the majority of doctors will say no, but there will still be a small minority of doctors that will say yes. And because of this small minority of doctors who actually allow women to have a vaginal birth after 2 Caesarean, that is why you do have examples, you have live examples of mothers who can tell you that I had 2 Caesarean and my 3rd pregnancy is a natural birth and I did it. So they will, especially in certain mother group, they can be very encouraging. They will tell everyone that you can actually do it. But in reality, when they go around and look and ask their doctor, and their doctor will say no. So you see, that is why they are very confused. You know, I know someone have done it, but my doctor say cannot. So actually can or cannot. So that is why they like to PM me and ask me this question. Okay, so let's go back. Talk about basis of vaginal birth after Caesarean. So if you have 1 Caesar and you want to try natural birth, that's why I realized that one thing, when we choose to Caesar or when we are asked to Caesar, everybody will tell you that you need to Caesar because there is risk to the baby at this point in time. All these things that you need to know. If you do not Caesar, the baby will be at risk. But nobody actually explains that if you were to have 1 Caesar and then the next pregnancy you're pregnant again, and if you want to have natural birth again, you will also have a risk to your baby as well. So that's why one good example will be breech. Breech, a lot of people Caesar. When they Caesar, they just tell you that there is risk to the baby if you Caesar, so it's better to have a Caesar. But nobody tell you that the next pregnancy, if you want to have natural birth, that you will end up having a risk to your next baby. So in the guideline by the Royal College of Obstetricians and Gynecologists in UK, they actually made this one statement. They made this one statement that mentioned that by doing a Caesarean for your baby, for breech, you are actually passing the risk of your first baby to your second baby. See, you are actually not reducing your risk at all. You are just passing the risk from the first baby to the second baby. Why? Because for breech delivery, the risk to the baby is less than 1%. 99% of breech deliveries, especially those breeches that fit the criteria for natural birth, actually a lot of breech can have natural birth. Especially when we talk about 10-20 years back, most of the breech have natural birth in the government hospital. When I used to be in government hospital, we used to allow breech natural birth. So breech that qualify to have natural birth actually have 99% chance of a safe delivery. But you have a less than 1% chance of something happening to your baby if you choose natural birth. But nowadays, we scissor all our breech. So when we scissor all our breech, we actually pass this 1% risk to the next pregnancy. Why? Because in the next pregnancy, if you choose to have natural birth, you run the risk of scar rupture. We always worry about the scar opening up the next pregnancy. And if the scar rupture, there is also a life and death risk to your next pregnancy, to your next baby. Okay, so we are actually passing it. And the risk of scar rupture, if you have one cesarean, is also less than 1%. So you see the risk of a vaginal breech, a breech baby having a natural birth, and the risk of the scar rupture in the next pregnancy is the same. So that is why when you do a Caesar, you're actually passing the risk to the next baby. And nobody mentions to any mother when they ask you, hey, you must Caesar, this one very dangerous, please you Caesar. But you never say that, actually you Caesar, you pass the risk to the next baby. So please choose, you want the risk in this baby or next baby. Nobody actually says that. So a lot of mothers, when they make when they're asked to Caesar, they just think of that situation and they think, yes, I must save my baby, so I just sign. So actually nobody realized that they actually put themselves in becoming high risk pregnancy in their next pregnancy, because once you have one Caesar, your next pregnancy is high risk. So high risk, one of the risks that happens in the next pregnancy is we worry about scar rupture. And then scar rupture usually, not always, usually happens when you have during labor. It rarely happens before labor. It can happen. There are people who rupture without any signs of labor, but it is very rare. Most of the time when it ruptures, it is during labor, when you're in the hospital, in the labor ward, when you're having your contraction, that is when the scar rupture. With one Caesar, the scar rupture is less than 1%. And because of that, most of us feel that you should be able to try again. But there will still be a small minority of doctors who will not accept this risk, and they will tell you that no, you have to go for cesarean in your next pregnancy because there's a risk of scar rupture. So but actually it's not fully true, because most cases we still allow. I mean, the risk is there, but the risk is less than 1%, and according to all guidelines, all SOPs everywhere, actually all others with one Caesar should be allowed to try natural birth. Now the $1 million question is, what if I have two Caesar? Two Caesar, what happened? Can I try normal birth? Can I try the vaginal birth the next time? So, thing you must understand is, number one, when you have two Caesars, the scar rupture risk now goes up higher. For a few reasons. You need to understand who we are talking about. Who are these mothers who want to try a vaginal birth? Are you a mother who had two Caesar and never had a natural birth at all, and now you want to try natural? Or are you a mother with like 7-8 birth already? You have like so many natural birth and also you have two cesarean. So these two groups of women are totally different type of people. But if you are going to compare these two groups separately, now I'm going to compare somebody who have many natural birth and have one Caesar, and somebody who have so many natural birth and with two Caesar, and both these women want to try natural birth. Actually, we know that the risk of the scar rupture in the second, the one with two Caesar, doubles the one with one Caesar. So it is again about maybe 1 to 2%. So you think about it, if it's 1 to 2%, then it's actually still very low risk. It's actually still very low risk. And if you think about it, then by right, these mothers should be allowed to have a natural birth. But there is a difference with the other group of women whereby they have two Caesars and they never had any natural birth. So what I notice about these women is that the fact that they have two Caesars, that makes their risk of scar rupture very much higher. Why? It's because it means they are not easy birthers. Like I like to always describe to all my patients, as well as when I describe in my VBAC seminars that I do. Mothers, they are easy birthers and difficult birthers. Easy birthers, actually most of the time they will end up with natural birth. Even if they end up with one Caesar, high chance the next pregnancy when they try, they will still be able to have natural birth. But if difficult birthers, then they have a tendency of ending up with Caesar again when they try again. So majority, not all, but majority, because I had this one mother who had 2 Caesars, but she never tried one. She just Caesar lah is a choice, and then after 2 Caesars, then she want to try. So this is a different mother because she never tried. But for mothers who have actually tried natural birth, went through the hours and days of labor and end up with Caesar, 1 round, 2 rounds, they are categorized as difficult birthers, because if they are easy birthers, they will have natural birth anyway in either one of them. But because both also end up with Caesar, then they are more likely to be difficult birthers. And for difficult birthers, your scar rupture risk is very, very high. Nobody can quote you the exact, because there's no research, but based on the experience I have in this group of mothers, their scar rupture is actually very high. So go back on history. For me, I used to work in a government hospital that allowed 2 previous Caesar natural birth. They allow, but their criteria of allowing, it is so strict. They actually only allow a very short phase of labor. So you look at, if let's say you have 1 Caesar, if you are in a government hospital, we have SOP, yeah? So if you have 1 Caesar, you want to try natural birth, they only allow around 6 hours, maximum 8 hours of active labor. So you only have 6 to 8 hours chance to go into labor and have a natural birth. If after 8 hours and you're not delivered, then you will end up with a cesarean. So if you look at that situation, if you're easy birther, 8 hours is enough for you. But for difficult birthers, 8 hours is not enough. So that is why they will still end up with a cesarean. So for 2 previous Caesar in this particular hospital that I used to work in, because they actually have many, in this particular place I work, they have many children. This is in Kelantan. Kelantan people, when I was there, it was like 20 years ago, they have many children. So we're not talking about 5 children, 10 children. They are talking about 10 children, 20 children. So many of these women actually, even though they have 2 previous Caesar, but they have like 10 natural birth and 2 Caesar. So we actually allow these women to try natural birth, but their criteria is when you reach hospital, active labor, within 1 hour you must give birth. If within 1 hour you can give birth, I let you have natural birth. But if within 1 hour you cannot give birth, then you cannot have natural birth. You still need to go for Caesar. And trust me, these women will give birth in 1 hour because they already have 10 natural birth. So if you have 10 natural birth, birth is like going to be super fast and super easy, and that is why they actually can. And when they do the research on this bunch of women, the risk of scar rupture is so low. The risk of scar rupture is low is because they are easy birthers. They are easy birthers. So that is the difference. So when you look at people with 2 previous Caesar, if you have many natural birth, of course, if you want to try again, your risk is very low. So it is actually worth trying, and you should be allowed to try. But when you look at 2 previous Caesars, another scenario I want to just highlight is like, traditionally in this particular government hospital, we allowed 2 previous Caesar to have natural birth, but we only allow 1 hour, and based on our experience, it is relatively safe. So we allow. But majority of hospitals in Malaysia actually do not allow. It is not a routine practice. Based on most SOP in majority of the hospitals in Malaysia, we don't allow. But what happened is that over the recent years, there are more and more cases where people actually allow, and there are also more and more research done all over the world trying to allow these people to have natural birth, and they find that yes, the risk of scar rupture doubles, but it is not like super high. So in some of the guidelines that are overseas guidelines, they actually say that it's allowed. So there are guidelines overseas that mention after 2 Caesar, you are allowed to have natural birth. So now the question is, what happened in Malaysia? Malaysia, there are still a lot of people, a lot of doctors that don't allow. Partly is, I tell you what's happening. Let's look at China. We look at China first before we talk about Malaysia. China, all these years is a one-child policy. All these years is a one-child policy. So all these years in China, they only allow one child, and there is a tendency for cesarean. I do see a lot of women from China, and many of them actually have cesarean birth. So previously, they are all one-child policy and they have cesarean birth. Many have cesarean. I'm not saying all, but they do have a very high Caesar rate. And now we know China now allow them to have more than one child. So actually, China face a problem of a lot of previous Caesars trying to have natural birth. They have a lot of previous Caesars trying to have natural birth. So when I went for a conference in China, in Hong Kong, about just before the pandemic, around I think 2019 or 2018, I actually went to Hong Kong for a conference, international conference in obstetric. It's on fetal maternal medicine. So there are quite a number of speakers from China who were there talking about their experiences of scar rupture. And when you look at them giving their talk, in our heart, we know that their high number of scar ruptures is actually due to few things. Number one, when they did the Caesar for this bunch of women those days, they were not prepared for them to go for natural birth. Because we know how we repair the wound matters. So how they repair the wound matters in the risk of scar rupture the next time. Like in Malaysia, we all repair a standard method because we are all prepared that all of you want to try again the next time. So we will repair it this way. We will repair double layer. We will repair it more securely. But for women who gave birth in China those days, the doctors are not really preparing them for another natural birth. No, because they only have one child. And that is one problem. Another thing is their doctors got no idea how to manage previous Caesar trying for vaginal birth. Because when we see how they present the case, you can really see like they got no idea how to manage people who want to try natural birth after cesarean. So for us here, because Malaysia on the whole, we still try to encourage more natural births. So we have so many people with one Caesar going for natural birth. And we have SOPs that are well written, set in all our hospitals. So we train all our trainees what to do if this person have a Caesar and trying for natural. But in China, they don't have much of this experience. And you must understand, China is a very big country, has so many hospitals. So some of the hospitals in China probably really have not even a single doctor who had experience helping these mothers who had previous Caesar trying for natural. And as a result, they have a lot of scar rupture. So when I think back about 2 previous Caesar, although the guidelines overseas allow, but you must understand, general SOPs in all the hospitals in Malaysia do not allow. So we do not train our junior doctors, our trainees, what to do if a 2 previous Caesar want to try natural birth. So most doctors in Malaysia have hardly any experience managing 2 previous Caesar trying for natural. When I was in Kelantan, they used to allow, but they also have a fixed SOP, and not many people qualified. You must have so many natural birth before you talk about allowing, and we only allow you 1 hour, so you come in within 1 hour, you give birth well and fine. If not, I'm still going to Caesar you. But it's okay because those women have like tons of babies. They will give birth within 1 hour. That's very easy for them. So that is why in Malaysia you will find that majority of doctors actually do not allow. Because number one, they are not experienced. And if you ask me, if you were to ask me, looking at what our Malaysian mothers are like, you will realize that most of them, especially if you're talking about women in KL, in the Klang Valley, we're not talking about Kelantan women, we're not talking about women who stay in KL and Selangor. In the cities, many of them are actually 2 previous Caesar without any natural birth at all. And many of them have already tried. So if you have already tried 2 times and it already failed you, if you already did not have a natural birth, which only means one thing, you are a difficult birther, which also means one thing, that a risk on you is a lot higher. It's not just about double or 1% become 2%, it is a lot higher. So my advice is not encouraged to do it if you never have any natural birth before. So the question of Eileen was very simple. Can 2 previous Caesar allow natural birth? My answer would be, number 1, based on overseas guideline, yes. Based on local guideline, no. Number 2 is, if you want to try, you need to find a doctor that will support you. Don't try to deliver at home. There were cases who do that because after 2 Caesar, no doctors want to let her try, and she want to try, so she tried to do it at home. We have cases in Malaysia, mothers die, babies die at home, and I do know all these cases as well. They are real life cases, so don't try at home. If you have a qualified obstetrician who is willing to support you and allow you to try, I think it's fair. You can try. But if you don't have a qualified obstetrician, that means now you are either trying to give birth at home with some maybe experienced women who think they can support you, or you actually found a doctor that is not an obstetrician who say that you want to try, I can help you. She's a doctor, but she's not a qualified obstetrician. I think it is very, very dangerous. Even for an obstetrician who's going to support you, it is already very high risk because she or he may not have much experience as to what to do with women who have 2 previous Caesar. So it is better not to do it under a normal doctor who is not an obstetrician, and definitely no to try it at home. Okay, I know quite a number, it's not just 1 or 2, quite a number of women who already try it at home, and majority of them actually lost their baby. But there were cases that the mother died, but majority is actually the baby who died. So don't do it, because you will hear positive stories. You will hear positive stories of people who will tell you that they successfully do it, but people only tell you if they are successful. Let's say I tried to deliver at home and my baby died. I'm not going to tell the whole world my baby died because I tried to deliver at home. Nobody is going to put it in social media, but actually these cases are quite a lot. So if you can find an obstetrician who allow it, many years back, Selayang Hospital actually allow, but I think now they don't allow again. But if you can find a hospital or an obstetrician who actually allow you to try natural birth, I think that's fine. But if you can't, then it is best not to do it on your own or with unqualified people. But based on my experience, to be very honest with you, I have supported some, and that is what I noticed. If for women who have already natural birth before, not too bad, because they're going to have very easy birth and things will be quite simple. I also had one lady who had 2 Caesar, but she never tried at all any natural birth. That too, she just chose to Caesar one. And then now, when she found out that she has to tie her tubes after the 3rd Caesar, she didn't want, because she had many children. So this time she wanted to try. And in fact, she had a very, very fast and easy birth. But for those who have tried once and tried twice. Majority of them actually very, very difficult one, and these cases are very, very high risk. So my only advice for women who have had Caesar before is, if you had one Caesar, the second pregnancy, if you want to try normal, please, you need to go for a lot of classes, have a lot of knowledge, and need to attend a lot of VBAC courses, how to achieve a vaginal birth after cesarean, a lot of preparation, and you need to analyze, you need to have somebody who analyze your case with you, because that's what I do. My patients who have previous Caesar, I analyze their case. As I always say, don't walk back the same path. The last time you did that, you ended up with Caesar. Don't do the same thing again. You know, a lot of people is like, the last time they didn't do anything, they waited. Then after due date already, then they went for induction, they end up with Caesar. And this time again, they sit around and wait, and then not in labor, and then after in the due date, they go and induce again, and then they end up with Caesar. Why you walk back the same path? Don't walk back the same path. That is the most important thing. So normally with all my mothers who are under me, when they want to have natural birth after cesarean, I analyze the case with them. I encourage all of them, if possible, to attend certain classes. For my clinic, we have VBAC seminars that are specifically catered for women who are trying to have a vaginal birth after Caesar. I usually encourage them to attend the VBAC seminar, and also to attend some other childbirth classes. In my clinic, usually is a hypnobirthing class, and a lot of strategies will be in place for them. And if I see they are very stressful over their birth, I send them to see my therapist, so that they can accept their previous birth. Accepting the previous birth is very important before you embark in your current birth. Reading my book helps too. Then you will understand why, a lot of reasons why people end up with Caesar, and how you could change things. These are the things you need to do. I have been supporting VBACs all my life, so that is why I have all this revenue for women, seminars, I have book, I have courses, and until today I still support a lot of VBACs. So when people ask me, Doctor, I have a previous Caesar, I want to try natural birth, where should I go? I say, I always tell people, if you have previous Caesar, you want natural birth, the best place to go is my clinic, not anywhere else, because we still maintain less than 5% cesarean rate in all women, whether VBAC or not. Okay, so because with VBACs, you have a lot of things that you cannot do like normal, and unfortunately, I don't see many people doing that. So that's why for VBACs, I generally say, if you want to have natural birth, the only place to go is my clinic. Okay, so yeah, I'm not saying that other doctors are not good, no lah. I'm sure there are other doctors who are very good too, but I do not know where they are. But if you are not a VBAC, I know where they are. There are a lot of doctors who encourage natural birth one. There are a lot of doctors out there who encourage natural birth, but I also realize that even for doctors who encourage natural birth, many of them, when it comes to VBAC, they still have a slightly higher cesarean rate. That is why, for those of them who I know, also I still feel it's better to be me and not them. But anyway, I do not know all the doctors in the country anyway, so this is my general advice for most people if they ask me the question. Yin asked this question. She said that I was emergency Caesar for my first baby due to poop while I am in labor room. So what I think she meant is the baby poop when she was in labor, yeah? Any scanning should I do before the second pregnancy to check whether I can go for VBAC? Okay. When we want to assess a person, whether a person can go for VBAC or not, then I usually look at few things. I mean, there is no strict guideline. Who can go for VBAC, who cannot go for VBAC. But we mainly worry about scar rupture. And if you want to look at whether there's possibility of scar rupture, there are two things we can do. Before pregnancy, you can always look for isthmocele, which we call a niche in your scar, or isthmocele. This is something that is linked with more cesarean. You can actually do a special scan for people who have previous Caesar to look at their scar, to be able to assess whether or not this person's risk of scar rupture is high or not. I mean, there is a scan and you want to know more about this scan, you can just go and look at one of my previous video. I actually have a previous video on this previous scar with ismosil. So ismosil is a gap in your previous Caesar. So your scar has a gap. Before even you're pregnant, we already saw the gap. So if your scar has a gap, there is a certain criteria how much of gap you have, then your risk of scar rupture is high. So that is one thing. But when you look at it, what is your next step? Not many people know what to do because ismosil is a relatively new thing. It is relatively new. If you look at my video, I will have explained that it's a very new thing. I mean, this thing has been there for a long time. I already noticed for a long time, but only recently the researchers show that if you have an ismosil, means your risk of Caesar is higher. So that is why, the risk of a scar rupture is higher. So now we know that we can actually roughly tell who will have a slightly higher risk of scar rupture if you get pregnant. But the question is what to do. So the answer is whether will you still try? There's nothing saying that you cannot try. There's no guideline that say you cannot try if you have ismosil. So will you still try? Or maybe you don't want to take the risk because your risk is high, so you don't want to try. Or are you going to repair the gap before you try? Which means that you're going to do another operation to repair the gap before you're pregnant. So these are the things, nobody have an answer to it, but these are the options. Then the next question is, the next scan that you can do is during pregnancy, because during pregnancy also we can do a scar thickness test, and we know that if we measure the scar thickness, the thickness of your old scar, we also roughly know whether your risk is higher or not. But your risk is higher or lower. It's not like if your scar thickness is less than this, you are 100% going to have scar rupture. Also don't have so again, there is no guideline no guideline to tell you that whether you can or you cannot do. But we know there are scans that we can do to roughly tell whether your risk is high or not. Of course, if you do not have ismosil and your scar thickness during pregnancy is like so thick, of course you're quite safe lah. You're quite safe. So you know you're quite safe, so you can go and try. But the other way around, nobody knows lah. Honestly, nobody knows. And no guideline because the percentage is not like 100%. So you can still try. You may still end up with natural birth. So there is no guideline or SOP to say that what findings cannot have natural birth. So in general, most of us will say, if you have one Caesar, you want to try again, you can try. As long as your previous Caesar is not the complicated type of Caesar, it's a straightforward Caesar, you can try. But for someone like Yin Yin, because she mentioned that her previous baby pooped during the last Caesar, the last pregnancy, I would sit down and think again, analyze the case, why the baby pooped, and hopefully this time we should avoid that situation again. As I say, don't go back, walking back the same path. Understand? Don't walk back the same path. You Caesar the last round, because of that, don't do the same thing again and then end up with the same problem again. Next question, nothing to do with Caesar now. It's a question from Salwani Sobri. Salwani Sobri asks, Doctor, could you please elaborate about Braxton Hicks? She wants to know what is Braxton Hicks. So what is Braxton Hicks? Braxton Hicks is actually the uterus contraction early before your actual labor. So some people, they can have certain uterus contraction at 4 months, 5 months, 6 months, 7 months, 8 months. It's long before your actual birth. Some people like to call it as practice labor. That means your uterus is trying to practice how to have contraction to prepare you for actual labor. It is a simple term to describe to people that is practice labor. But actually, through my many years of experience, I realized that actually Braxton Hicks is the actual contraction. It's the actual contraction that you need to have. Because when you look at labor per se, labor is not overnight. It's not over 1-2 days. It's not over 3 days, 5 days. It is over 9 months. You realize that is why one of the things that I do for most of my patients 1 month before their birth is I measure the cervical length. When I measure your cervical length, I can roughly tell when you give birth, whether you have an easy birth, difficult birth, whether your cervix is going to open easy, open difficult, open fast, open slow. A lot of things can be told in just one ultrasound scan 1 month before your birth. So when you look at it, you will realize that some women, they never seem to have any Braxton Hicks all their life, all the whole 9 months. They can tell you, I've never felt anything at all. And then when you look at their cervix, it's like never going to open. Never going to open. So what happens is actually in pregnancy, you have these contractions that come and go throughout your 9 months, slowly opening up your cervix. It is actually slowly opening up, because we know that for a cervix to open, there are few things that need to happen. Number 1, it has to soften. Number 2, it has to shorten. Then number 3, then only it can open. So you actually need all these contractions for 9 months to slowly soften and shorten before the final few days when it starts to open. So if you have no Braxton Hicks contraction throughout your 9 months, then how is your cervix going to soften or shorten or open? So you actually need these contractions. And in fact, it sounds like practice labor. Your body is practicing labor. But sometimes you can't tell the difference, which one is practice and which one is not practice. That's what a lot of people say. How do I know this is Braxton Hicks? Well, how do I know this is not Braxton Hicks? Honestly, you can't know, because they are actually the same thing. The only difference is, okay, if you tell a doctor, then we can roughly tell. If my mother tongue tell me that, doctor, I always have these contractions, I'm not sure whether I'm going to go into labor or not. Very easy. I can do a scan on your cervix and I know, not shortened, not soft. I won't go into labor so fast. All this is just Braxton Hicks. This is just practice labor, nothing normal. Like that. Of course, for us, we can tell. But for you, you can't really tell except one thing. The only thing you can differentiate is whether it's regular or not. Because Braxton Hicks usually is like 1 time, 2 time, 3 time, and then stop. But labor contractions usually keep coming. It's not just 1, 2 time and then stop. Braxton Hicks usually it just come few times and then it stops. It doesn't come anymore. And all this is not the real regular contraction. No? So that is roughly how you can tell. But there are certain issues with this so-called Braxton Hicks. Some women, you see, women, all kinds of women, all kinds of mothers. Some Braxton Hicks are there, they can't feel one, they feel nothing one. These I always say are lucky women, because to me Braxton Hicks is still contraction, it's just milder. So if milder, you don't feel anything, which means that your contraction need to be a lot stronger before you start feeling. And it needs to be extremely strong before you start to call it pain. But there are some women, at even 5 months, 6 months, the very, very mild contractions, they already start to feel pain. And these women actually, they need to know that if they feel pain with all these mild contractions, then when the contraction gets stronger, they are going to find it more and more painful. So that is why this group of women, if always complain pain because of contraction, then my advice for them is they need to know how to do something to be able to cope with this pain so that they don't end up having a seizure. Actually, many of these women who can feel pain in early stages of pregnancy, many of them end up with seizure one. So you can buy my book and you will realize what I'm talking about. There are a few cases in my book that I explain that why they ended up with seizure. They end up with seizure because they admit themselves in hospital because of contraction pain that is not even in labor. They are not in labor, but because the contraction pain is so strong to them, it's really so painful. Because mild contraction, you already say pain. Slightly stronger contraction, which is not even moderate, maybe just still considered mild, but slightly stronger, you will already find it's very painful. So you end up admitting yourself to hospital for a contraction that is not even in labor. So that is why these women tend to end up with Caesar. So you need to know how to reduce your pain, methods of reduction of pain, and these things are something we teach in the hypnobirthing classes. So that's why when I identify this group of women, this group of mothers who see me, I always tell them, you better attend the hypnobirthing class. If not, when the contraction goes up double of what you're feeling now, you'll be crying already, but you're not even in labor. How? So unless you're willing to go for cesarean, if not, better go and attend hypnobirthing class. Okay, so that's it. Alright, for those of you who haven't read my book, I have a book on ways to prevent Caesar, and that book you can buy either from Lazada. The name of the book is Caesarean Birth, The Path Untold. If not, you can also buy from my website, citywomanandchildclinic.com. So you can buy it from buy this book. Yeah. Next question is from Amy. Hi, Amy. Amy asks, hi Dr. Tan, as I have adenomyosis, do I need to be more careful to choose the doctor during my pregnancy and giving birth? Adenomyosis, Amy, as far as pregnancy and birth is concerned, there's nothing's too much problem unless your adenomyosis is very bad. Okay, as I described in my endometriosis video, we want to look at how big the percentage of your uterus got adenomyosis. If let's say it's only 20-30%, actually this group of women got nothing one. They have normal pregnancy, no risk, nothing, and then at the end they can also have natural birth. It's when your adenomyosis occupy like 40, 50 or even more than 50% of your uterus. This group of women, number one, they got more miscarriages, then they have more premature labor. And if they don't end up with miscarriage and premature labor, many of them actually have very, very difficult labors because the part of the uterus with adenomyosis cannot function, cannot contract to push your baby out. So you're depending on the parts that are normal. Can you imagine half your uterus is adenomyotic, so you only have another half. So you only have 50% of the strength to push the baby out. So that makes labor definitely a lot difficult. But no harm trying if you want to try. It's just that labor will be a bit more difficult, that's all. Other than that, there's actually not much risk involved either. So any doctor will do. Okay? Next question is from Eileen Coy. How long should I wait? Should a mother wait for first pregnancy Caesar and second pregnancy also Caesar? Is it must wait for at least 3 years? No. If your first pregnancy already Caesar, normally after the first pregnancy, if you end up with Caesar, normally we will advise you to wait a gap of 2 years before you conceive again. When we talk about 2 years, we are talking about the gap between the two children must be 2 years. Not necessary you must wait until really 2 years only get pregnant. In fact, most women, I say anytime more than 1.5 years you can try lah. Or babies also don't come overnight ma. You try so may not get pregnant straight away. You may need time to get pregnant. So after 1.5 years you can try and pregnant again. One of the reasons why we want you to wait is because we think and we presume that you want to try natural birth the next time. So if your pregnancy is a Caesar and you want to try natural birth the next time, that's why we ask you to wait about 1.5 years to 2 years before you get pregnant again. Partly we know that the longer you wait, the scar is stronger, so it's better for you. But if you already have 2 previous Caesar, you have 2 Caesar already, now your next pregnancy, most likely you're going to end up with Caesar lah, because most doctors in Malaysia would not allow you natural birth ma. So you're going to choose a Caesar already. It's going to be a planned Caesar in your 3rd pregnancy. If you're planning a Caesar for a 3rd pregnancy, you don't actually need to wait so long. Anything more than 1 year, I mean, if you really force yourself, you have to get pregnant fast. 6 months lah minimum, but not so advisable lah. Minimum 1 year lah. After 1 year you are pregnant lah. We're going to Caesar you anyway. We're not going to let you try, so it doesn't really matter. You don't have to keep a very strong wound. Partly is because it's fine, you're going to have a Caesar. If my baby weight is 1.4 kg at 31 weeks, is it considered big? No, 31 weeks, 1.4 kg is not big. How many weeks we are advised to do perineal massage? Perineal massage is a massage that we teach in our antenatal classes to help you, how would I say, reduce the tearing lah when you have your natural birth. Because if you can massage your perineum to widen the whole perineum so it become looser, then your birth normally will have less tearing. So normally we say perineum massage should be done after 36 weeks. Yeah, I'm now at 31 weeks. How do I overcome pelvic pain? Is it a good sign? I mean, pelvic pain has nothing to do with your birth. It's not a good sign or a bad sign for birth. Pelvic pain, I'm not sure what you mean by pelvic pain, but when we talk about pelvic pain, we always talk about pelvic girdle pain. Pelvic girdle pain is due to pregnancy. It doesn't affect your birth in any way. It is due to certain muscular or ligament strain because of the pregnancy, and it has no effect on the pregnancy or birth, okay? It's just that mother in pain, that's all. Now, Lu, doctor, if having cramp and brown discharge during early pregnancy for 4 to 5 weeks, should it be a concern? Of course it's a concern, okay? You are not supposed to have so much brownish discharge during pregnancy. Anything to do with Caesar before? It can. As I mentioned in my video of Isthmosil also have a tendency of causing this type of bleeding. So it can. So if you have previous Caesar and you have bleeding in your early pregnancy, you need to see a gynae to assess your previous Caesar as well, okay? Your previous scar. Vivian Cole has a question. During induction of labor, baby went into distress. So must the mother go through a cesarean or can have normal birth? I think last week I also answered this question. Is when you have a baby's heartbeat go into distress, means usually we talk about baby's heartbeat either too high or too low. The first question everyone need to ask themselves is why. You know, if you want to be it's easier to be an obstetrician to just say heartbeat go down, Caesar, heartbeat go up, Caesar. It's so easy, right? And you don't need an obstetrician even to make that type of decision. Anyone can make that type of decision. But through years of experience, most of obstetricians, they don't do that thing anymore lah. If you're junior doctors, that's what we usually do lah. Are you heartbeat down or scared or quickly go Caesar? Or heartbeat high or quickly don't go Caesar? But when you have more and more experience, most of us, we actually don't do that. We actually think about why the heartbeat change, why your baby distressed. So the heartbeat change, we need to answer the question why. Is it because of the induction? If it's because of induction, is there something I can stop the induction? Because there are cases like that, you know, when we put on the drip, you know, the drip for induction, the drip, and then the heartbeat go haywire, and then the baby go into distress, and then we off it, then the baby is happy again. Then after about 2 hours, we let the baby rest and happy. Then we on it back, and then go into distress again. And then we off it, and then the baby is happy again. So these are our cases. We do see it on and off, and you know that the only reason the baby is in distress is because of the drip. So then you have to question yourself, then cannot have the drip, or you have to use other ways of induction, or maybe other ways the baby can accept but not the drip. So sometimes if a doctor wants to take things easy, that means anything Caesar, of course life can be very easy, but also mean that you have a lot of Caesar. But if you want to use your brain and think, that's why I say doctors who encourage natural birth tend to use their brain more. They tend to use their brain more. Because when they have a situation, they have to think why, how, is there anything I can do before I say the word Caesar. So that's when you can see the difference, which is the thinking doctor and which is not the thinking doctors, okay? So the answer to you, Vivian, it depends on why your baby have fetal distress. Is it due to the induction medicine? If that is the reason, can I stop the induction? Or there are things that you can do. There are even injections that you can give the mother to stop the injection. That's something that I do sometimes as well. If it's due to the induction and that medicine, there's no way I can stop, then I can give we call antidote, you know, the anti to the induction medicine. So I give you this jab, which is an antidote to the induction medicine, and then your contractions will stop, and then the baby gets to recover, the baby's heartbeat goes back to normal. Then actually we don't need to Caesar immediately, but we need to think about what's next, you know, because there must be a reason why I need to induce you. So no matter how, you still need to give birth. in a certain duration of time. So if I cannot induce you and your baby go into distress because I induce you, I still need to be able to find another way of helping you give birth in an X number of hours, in a certain number of hours. So these are things that we need to think. As I say, doctors who have more natural birth are usually the thinking doctors, okay? Evelyn Tam has the next question. Evelyn Tam say, is it normal after 9 months of cesarean, the scar is still having pain on and off? Yes. I mean, it's not, I wouldn't say it's normal, but it can happen. I always describe to a lot of women when they have cesarean, wound are all kinds. Recovery, all kinds. Some people have very nice wound outside, but have very bad scars inside. I'm talking about scar. When you're talking about 9 months after the cesarean, we're talking about scar. Some have very nice scar outside, but have very bad scar inside. Some have very bad scar outside, but very nice scar inside. So nobody actually knows what kind of scar you have. Of course, if you have nice scar inside and outside, that would be the best. So if you still have pain after 9 months, there are two possibilities for pain after 9 months. One is there's some scarring problem inside that is not so good. We call it usually due to adhesions. You can have adhesions after any surgery in the world, including cesarean. Although we say cesarean usually have less adhesions, but you can. Very rare, but you can. And these adhesions can cause pain long term. Long term, we are talking about for the rest of your life. The other one is cesarean scar endometriosis. Okay, cesarean scar endometriosis is a complication of a Caesar. It is a side effects of Caesar. Caesar has one side effect that it can form is cesarean scar endometriosis, and that can cause pain too. And that is not so good a news compared to adhesion. I rather have adhesion, because adhesion means my scar is not nice. My scar is not nice, it will be not nice, and it will be just like this. It will be not nice for the rest of my life. It doesn't get better, but it also doesn't get worse. But if I have a cesarean scar endometriosis, endometriosis is a disease that will worsen in time, that will worsen with time. So it's going to cause you more and more problem over time. So it is something you need to solve. So what I would do is, if I were you, I would tell you need to go and see a gynae, need to assess whether there's a possibility of endometriosis in your Caesar scar, because if there is, you need to start on treatment. You want to know more about endometriosis, I have a whole long 8 videos on endometriosis that I did over the last 2 months. You can go and view it. Caesarean scar endometriosis, it is a very unique endometriosis on its own, but it is a thing that will progress with time, so you definitely need treatment. If not, then you will end up with a lot more problems in the future. Yeah. Okay, so some of you may wonder, since I still got a few more minutes, might as well I just cover the topic on cesarean scar endometriosis. We know in endometriosis, if you have seen my videos enough, you will know in endometriosis, what is endometriosis? Is the inner lining of the uterus, but now grow in a different place. So we always say that it happens is because of backflow of period blood. So when your period blood flow, then it brings the inner lining. But that is the normal endometriosis that we see in most women. But in cesarean scar endometriosis is different, because we open up the uterus. We open up the uterus, then we take the baby out. Sometimes when you take the baby out, the inner lining of the uterus, or when we take the placenta out, the inner lining of the uterus follow the baby, and the placenta also come out. Okay, so when it comes out, what happens is that when we stitch, we don't know which is blood, which is inner lining, because inner lining is red, blood also red, muscle also red, uterus also red, everything is red in color. Nobody knows that actually there is some inner lining that is stuck, maybe at the wound there, and when I stitch, I actually caught it inside. So if there's some inner lining here, and I'm stitching this place and this place, so when I stitch it up, I caught this inner lining inside. So when I caught this inner lining inside, this inner lining now is no longer in the inner part of the uterus, but it's on the scar. And this inner lining will continue to grow. and it causes pain because endometriosis causes pain. So in the endometriosis in the Caesar scar causes pain. And most of these women, you only got two options. One is to actually go for an operation to remove the endometriosis, or the other way is to go on long-term progesterone medication, which I explained in my videos on endometriosis. Yeah. So that's all I've got to say for today. As usual, time's up. I answer questions until 10 o'clock. That's all. So if you have any question, you put in the comment section. And once again, thank you for joining me in my weekly Sunday 9 p.m. live video. If you have anything that you have missed, whether about Ismosil, whether about whether you want to know more about the pros and cons of cesarean or endometriosis, please go to my YouTube channel. Yeah, my YouTube channel is Dr. Tan City Clinic. Please subscribe and switch on the notification button. Yeah. Okay, so, and for all your questions today, thank you. I saw so many questions coming in throughout my whole video. I will look through it and I'll try and answer in the weeks to come. Okay, so that's all for today. See you next week, same day, same time. Thank you and bye-bye.